Our next item on our agenda is to hear from Mr. Brett Lakeman. We're glad to hear you, Brett. He's our Chief Financial Officer with the Alleghany County Memorial Hospital. Welcome.
Good morning, Commissioners. Thank you for allowing us to be here today. If you'll indulge me briefly, Commissioner Lee's commented during the community college presentation that she was glad to see correlation between doing the numbers and driving a tractor. So I just want to report somewhat proudly that about 3 weeks ago I drove a tractor for the first time in my life. And not only did I drive it, I was a little productive. I got to kick A for about an hour. So I was very happy with that.
I have told some of the folks that for an hour or a day spent on a tractor adds a day to your life.
I can appreciate that. So, but on a more serious note, and to get to the point of my presence here today, I've seen some of you individually and had the opportunity to thank you, but I have not had the opportunity to thank you collectively and officially for the support that the Commission has shown for Alleghany Memorial Hospital this year in the granting of the $100,000 subsidy. We appreciate that very much. We share your objective and goal, I think, to improve our situation such that that support is not necessary. And we have worked very hard to do that this year, and I think we have shown some positive results. It is our understanding that in conjunction with the approval of that subsidy, that there was consideration given that as we approach September 30th, if we felt like that we were close to meeting our day's cash covenant for our loan agreement, that you would entertain a request to authorize distribution of the remaining balance of this year's subsidy. And so that is why I'm here today. As I said, we've worked really hard this year to improve our results, focusing on growing our revenue and managing our receivables to increase our day's cash position to meet that covenant. Since last September, we have grown our days cash from 27 to 34 as of the end of July. As of the end of August, that was down to about 30 days. And it's important to understand why that is the case. We have payroll every 2 weeks, and the calendar was unkind to us in August in that it produced 3 payrolls in that given month. A single payroll equates to about 6 days of cash for us. So that pulled our balances down at the end of August, and we are working to recover, estimating us to be at about 32 days as of the end of last week. Now, forecasting our days cash is problematic at best. Our weekly cash collections vary widely from week to week and are almost entirely unpredictable. We have very little information coming from our insurance, the companies that we deal with, as to how much and when we will be paid. Medicaid tells us each Monday how much we're going to get that week, and each day we get a report from Medicare forecasting the next 7 days. That's really the best we've got. So our projections are based on long-term average weekly collections, and by long-term I mean for about a year. Our projections say that if we hold at average, we'll be at about 35 days, September 30th. But the variability that can come in those averages makes it a bit of an uncertainty. For instance, an average week of Medicare receipts is about $78,000. Last week we received $150,000. This week we're projected to receive $25,000. So you can see how it just swings greatly from week to week. That leaves us with, there's only 2 ways to manage your cash: bring it in or control what goes out. And to the extent we can't control what comes in, we have to diligently manage what goes out. So with those things in mind, there's several other specific factors that I could bore you with. I won't go into the details unless you'd like me to, but expressing that or illustrating that volatility and the uncertainty in our forecasts we're here today to respectfully request that the commission authorize distribution of the remaining funds under this year's subsidy as an insurance policy for us to meet that 35-day target as of the end of September. And I'll close my comments with that and entertain any questions that you may have.
Looks we have questions, comments.
Required 35-day target
Yes, ma'am.
is tied to a loan.
That is correct.
It's a covenant.
It is a covenant under the debt agreement. That's correct.
If this, request is honored now, let's say next month or October, which is another long month, it falls behind, what's your plans to, come up with the cash then and meet that requirement?
Well, the requirement is measured as of the end of our fiscal year. It's not required that we maintain that throughout the coming year. We do have that there will be fluctuations from week to week. And with the biweekly payroll, you can really appreciate that. We surpass 35 on weeks that we don't have a payroll, and we fall below 35 on weeks that we do. And as arbitrary as it sounds, that measurement of compliance with that covenant is as of the end of the year only.
So you now say you have 32 days worth of cash on,
An estimate as of the end of last
and
week.
you're required to have 35.
35.
So considering where you were 2 years ago, it's remarkable that you have 32, correct?
I'm not sure what it was 2 years ago, but as of 1 year ago, yes, I'd say we have made great strides. And obviously, the commission's support has helped us get there, but we've come a long way operationally as well, and we have full faith and confidence that, especially with the specialty clinics we've initiated with Wake Forest, that we will see an uptick in our revenue, and we will profit from those activities. Not just the clinic days themselves, but the ancillary revenue it brings to the hospital in between clinic days.
Can you discuss the new clinics that the hospital has recently signed contracts with?
Sure. So it's all through Wake Forest, and we have currently 3 specialties coming to Sparta on a rotating schedule of 1 day a month. That is hematology, oncology, cardiology, and urology. They have met with great success, I think, to be so early in the process. We've had 2 oncology and 2 cardiology days, and I think 2 urology. Now, is it just 1 still?
No, we had 2.
We've had 2 urology as well. And the feedback from those patients and from the community in general has been very positive. There's a great deal of excitement about that. The oncology, for instance, and cardiology too, I think to a lesser degree for urology, but the patients that are being treated were in many cases already being treated by those physicians, but being treated in Winston-Salem or Elkin. And the convenience factor for those patients of not having to leave Alleghany County to go for their care. I mean, I'm sure you can imagine and appreciate that someone who's receiving treatment for cancer doesn't feel good to begin with, and having to drive to Winston-Salem and receive chemotherapy or any other type of treatment and drive back is taxing. They're very appreciative of not having to go off the mountain. The specialists have indicated that they foresee their volumes growing to the point of discussions underway to potentially expand those clinics to 2 days a month. For the impact it has throughout the rest of the hospital, many of those patients, they see the doctor here on the clinic day, and there's a treatment plan developed for that patient for the next month. And the patient will make sometimes multiple visits back to the hospital in the intervening weeks for treatments of one type or another, whether it be drugs or blood transfusions or other things. On the days of the clinics, As an example, the last oncology clinic, our lab manager commented that day, Dr. Albright's killing us today. A normal day's revenue for them is about $8,000 in charges, and on that day they generated upwards of $21,000 in charges. So it's early, but we're very excited, and we feel like that will be a great boon to the organization and the community.
Any other questions? I might ask the county manager if you have any reflections on this. Of course, how it might affect the budget one way or another. I mean, it's already been included in our budget.
It's allocated, and so it is budgeted, so it's, from a cash flow standpoint, it's not necessarily gonna impact. We're just through August, so we're actually at one of our heavier cash months, if you wanna call it that, because we just collected all the taxes of people trying to get their 2% discount. So from a cash flow standpoint, there's nothing that says that you could not do this. It's really a policy from the board standpoint in regards to how you wish to allocate those funds.
Any other comments or questions? I know that in our discussion, past discussion, it was as Mr. Lieberman said, we allocated or released the $50,000 with the acknowledgement that there might be an additional request. I believe Commissioner Lees did that. So, any other comments? Mr. Cooper?
Now, would we need a separate budget amendment?
No.
Okay.
Hearing no other comments, then the chair would entertain a motion one way or another in this issue.
And the motion would be, I just want to make sure I understand, it's simply just to forward $50,000 or half of the allocation current, instead of just allocating it quarterly. We're giving 2 quarters ahead of time. That's all we're doing, correct?
Historically, we did last year allocate the money quarterly, and actually was tied to a request coming each quarter.
And they've already received 50,000, so if you choose to move forward, it's basically just, it's a motion to go ahead and issue them the remaining 50,000 in the month of September.
So is there such a motion in order?
I make the motion to forward this $50,000 ahead of schedule, the last 2 quarters of this fiscal year on the current month.
Okay.
I would second.
And there's a second. Any discussion?
I would just like to say how much I and this board appreciate the work this hospital board has done to improve your bottom line. And it is a vast difference, improvement from what it was a year ago, 2 years ago. And it didn't just happen because things improved on their own. It was a lot of work, and you continue to do more work. And I think the hospital is such an important part of this county. For every job that the hospital provides, it's probably providing 3 to 4 more out in the county as auxiliary jobs. Drugstores, grocery stores, other doctors, nurses, and it's very important that we support the hospital.
Any other comments? We have a motion on the floor. If there are no other comments, all those in favor of the motion signify by saying aye.
Aye.
Any opposed? It's unanimous. Thank you.
Very much.
Appreciate it, and thank all the folks who came to the hospital. Appreciate it.